Hello, we've met again for another episode of the favorite oral health corner. Today we'll be looking at gingivitis, inflammation of the gum. We normally say bleeding gum, that is what we refer to, but when we talk about inflammation of the gum, it's characterized by the bleeding, it bleeds easily upon least provocation, or you can also say that the gum becomes bright red. Now, you normally detect that when you brush your teeth in the morning or the evening, you spit, you see stains of blood in it. Sometimes it will happen 2-3 days, it will go, then you will not see it again. But when you see it that way, there's an issue with it. Now, the gingivitis is caused by what we call bacterial plaque. But in our local plants, we say debris. When you see food debris on your teeth, after you have finished brushing, normally, and we've eaten, you see that the food will coat the teeth. And that thing that coats the teeth, we call it the bacterial plaque. It provides a home for bacteria to grow and then cause the trauma or the inflammation to the gum, leading to the bleeding. Now we look at the classification based on what causes it, and then 2, based on the part of the gum that is affected. Based on what cause, we've already said it is caused by a plaque, so that is no more in doubt. But other things can also predispose you. It means that if you have certain conditions present, it can let you have the gum bleeding in the presence of the plaque. So some are more predisposed than others. And one is malnutrition. If you don't have vitamin C, or if you don't have vitamin C, also known as ascorbic acid, you know of scabies. The scabie leads to gum bleeding. Then the absence of zinc, vitamin A, vitamin E, which are responsible for the repair or the proper growth of the mucous membrane. If you don't have them, it can also lead to some of this gum bleeding. Then we talk about systemic condition. Systemic condition here, we are referring to things like pregnancy, puberty, menstruation. These things can predispose you to gum bleeding if you have a plaque on your teeth. Then we have the diabetes, leukemia, and then we also have other bleeding disorders. They manifest through the gum, by your gum bleeding easily. After the pregnancy and then the menstruation is due to the hormones. Then we have medication. Certain medication can also predispose you. We talk about the oral contraceptives, some of them, not all of them, so speak to your professional before you take them. We also have something like the cyclosporin A, which is an immunosuppressant. We have, in the case of a hypertensive patient, we have calcium channel blockers, example, nifedipine, amlodipine, etc. They can influence gum bleeding. And then in the anti-epileptic drugs like phenytoin can also be a catalyst. In terms of the part of the gum, you can have the gingivitis just involving the margin of your gum, the part that embraces the teeth. Then we call this one the marginal gingivitis. We can also have some only restricting itself to the flesh in between the teeth. So we call the papillary gingivitis, that's the interdental, so the flesh in between the teeth will be affected. And we have one that will affect both in between the margin and even other part, we call the diffuse gingivitis. So based on the part, we have 3. Then prevention, we can prevent gingivitis by brushing properly morning and evening. We can also prevent it by flossing. Flossing removes the food debris in between your teeth. So floss at least once a day. In terms of the treatment, it can be treated by going to the dental clinic for professional cleaning. That cleaning can also be done every 6 months as a preventive measure of the gingivitis. Then we have mouthwashes that are also effective. Don't buy it by the roadside. See your oral health professional to get the appropriate mouthwash. Thank you so much for your rapt attention. Follow our pages or handles. Don't also forget to leave a comment for us to address it to you. Thank you so much.